right, let's talk to Chris. He's 22. Chris?
Hey, what's going on, Adam?
What's up?
I've had acne for about 8 years, and, I'm thinking about getting laser surgery to try and remove some of the scarring. Is that possible?
Yeah, a lot will depend on what type of acne scarring it is. There's different types of acne scarring. There's ice pick scars that are the real deep ones, and laser surgery certainly does not work very well for those because they go too deep.
What does work for those? Anything?
Not much. I mean, you can cut them out sometimes and get rid of the pick part.
I thought you could give
you can
put
collagen
injections and sort of attempting to sort of fill them up a little bit.
Sometimes, but the type of acne that works best for laser resurfacing is the sort of acne where it's shallower, more saucer-like. Then the laser kind of sands things down and kind of levels the field.
Really?
Pretty much what I have.
Yeah. What ethnic background are you? Are you Caucasian or?
Yeah, I'm Caucasian.
Yeah, that's the thing. You're probably a real good candidate for laser resurfacing, whereas someone who was a person of color, that you have to be a lot more conservative because you're worried about pigment problems afterwards.
Yeah.
But the only down thing about laser resurfacing is you have to really factor in the downtime, and if it's done aggressively to get rid of acne scarring or to improve acne scarring, you're looking at staying in your house or apartment for about a week to 10 days because you really look bad.
Oh, really?
Oh, yeah.
Because they take the pothole and they put a bunch of red pile-ons.
Oh, man.
Right?
Yeah, your face looks pretty bad for those first 10 days, and then you're pink for anywhere from several weeks to several months.
Do they, I see a fair amount of people who have acne scars, and they must be prone to it. Like, I know people think, well, that's just bad acne, but they also must be prone to scarring because, like, I've taken, like, pliers to zits on my face in the past.
Depends on the type of acne.
Stuck pins in it and stuff and wrenched on it. And I don't have any scarring.
Right. You probably didn't have the real severe form of acne that does lead to scarring.
So it's not so much what you do to it as much as what kind of acne it is.
Right.
And now if you had that today, what would you just take the medication?
Myself, certainly there's a lot of treatment options for it. There's some people do topical therapy that works real well. Other people have to go on something like Accutane, which is a much more serious medication.
But Drew says there's no reason in this day and age to really have an acne problem. I mean, not that you can't have one, but what I mean is back in our day, you had an acne problem, you had an acne problem. There wasn't a lot.
Right.
But people were talking about, well, stay away from the chocolate. You know, that is the kind of nonsense we're being fed.
No, there's certainly a lot of treatment regimens, and there's a lot of effective treatments for it now, but it's still a widespread problem, and not all treatment regimens work for everybody.
But Accutane is effective if it's a bad situation?
It can be very effective, but if you're a woman of childbearing years, they don't want you on it.
Right.
You have to follow your liver enzymes. I mean, it's a serious medication, so, I mean, that would be... If it was my kid, that would be a treatment of last resort.
Well, now so what would you do, and I don't know if you have an answer to this or not, but then I'll give you my regimen. But what would you do for just your sort of basic teenage acne? Not a big problem, but, teenagers aren't going to get zits. What's the best way to minimize that?
I send them to the dermatologist.
And they just lance them and suck them up? Or?
In my line of work, I don't choose to deal with much acne.
You don't run into that?
Nah.
But you might run into the scarring?
You might run into the scarring aspect of it, but I don't make a point of managing acne in my practice.
But you have anything you've picked up or anything any of your dermatologist buddies have done?
Retin-A certainly can work because it helps dry up the skin somewhat. Certainly a more regimented facial wash using some astringent toners can help.
Yeah. I'm a lancer myself.
Nice.
I like the lance. Drew doesn't like the lance, but I'm a huge fan of the lance. I'm a constant lancer, and I don't even, I just take the needle from wherever it was. I'll pick it up off the floor, pow, right in. Never, I don't do any of that stuff.
Sterile technique.
Hell no.
Yeah.
I've never had any problems.
Well, you're lucky.
Really?
Yeah.
If a needle's just sitting around, like in my bathroom, you think it's sterile or it's...
Well, it's certainly not sterile.
It's not sterile, but is it unsterile?
Is it horribly contaminated?
Yeah.
Probably not.
There's like a handful of fomites living on there.
Yeah, you know.
I'd stuff those right in my face. Now, see, I got the beard and stuff. I have to pick out the ingrown hairs. And here, I get a zit. Here's what you kids got to do. Don't do it because I don't want you suing me. But I'll tell you, the best thing to do with a zit is and stop me if I'm wrong here, but the zit, it's one pore usually that gets screwed up.
Right.
And there's usually sort of the mother pore.
Right.
And I go right to the source of the problem. You find that mother pore, and you take the pin, and you can see it, and you drop it into that mother pore, and it's like piercing the outside of a grape. You can feel it's a little tough, and then there's a little prick, and then it'll drop in. And once that thing drops in...
Kids, do not try this.
Don't do this at home, but this is what I do at home. And once you drop it in the mother pore, now you've got an opening for the mother pore. And now you don't have to squeeze on it. You can actually pull it apart. You just sort of drain the main pore there, and then Oxy-10. That benzoyl peroxide. Big dabs of it. You got a bad zit, drop it right on there. It works like a charm. All right, let's take a little break. Dr. Marcel is our guest tonight.